I'm here with Dr. Ahluwalia, and there's a new study on related injuries, NFL concussion-related injuries, and how the NFL isn't doing enough to help these players who get concussions.
Yes, so these players have filed a class action suit, and there's three parts to it. There's obviously the older players who have suffered from dementia, which is called chronic traumatic encephalopathy, which is related to concussions but happens later in life.
Oh, look at these hits.
There are people who are just out from the NFL who have started to have some symptoms for those people, and then monitoring in the NFL. So these are three different components. But I think what relates most to us is about our kids and what to watch out for and what concussion does to them. There's an acute phase and a chronic phase.
How do you know if your kid has a concussion on the field? Because sometimes you can't see it right away.
That's right. So there are guidelines for watching players who have concussion. So if your kid loses consciousness, if your kid has amnesia after the event, or is confused, take your kid out of the game. Just take your kid out of the game. Have them evaluated by a medical professional before they go back and play, because the second impact syndrome is the worst thing. Because
what happens? What happens? Because it doesn't actually affect them right then. No. It actually affects them in the future.
Yes, it makes the brain more vulnerable to a second impact. That's what it does. And we made all these helmets and all kinds of different things because we were having skull fractures. Well, we don't have any skull fractures anymore, but the brain is still vulnerable inside the skull. And so that's what we have to watch out for, and especially in developing kids. That's the most
Your
important.
advice on this, because obviously my ex plays football, my son wants to play tackle football, he's only 10. Should a child that young be able to play tackle football, or should they wait until high school maybe?
Well, it's a great game, and we don't want our kids not to be playing these games, but I think safety is important. So one of the new things that they just did is they figured out that most of the concussions happen in practice, not in real games.
That's what the NFL players were trying to do, was kind of make it so it's not full
So
pads.
now they've limited the number of practices a week, not only for NFL, but also for college and school. So I think that's going to, we're trying our best, but I think, a lot of these things still elude us. But I think as parents, we just have to be careful and monitor our kids and make sure whatever's safest is what is done.
Okay, and so speaking of kids and making sure they're safe, all the antibacterial soaps, we say put them on your hands. Now they're saying there's a chemical in some of those antibacterial soaps that is actually dangerous. Yeah,
this is a chemical called triclosan, and it was used still used in hospitals to be an antibacterial. But what has happened is a lot of the soaps and toothpaste and cutting boards and all sorts of things have this chemical in them. And the issue is that there are some animal studies that show that these may cause some thyroid problems, fertility problems, all kinds of different things that may lead to it. And what's also interesting is they found that almost 75% of people over 5 excrete this in their urine. So we all have it.
So it's you can check on the back of a label if your antibacterial soap has it. So the best thing to do, what you were just saying, is
wash your hands with soap, and that's the best thing to do.
Regular soap. Just wash your hands with soap and water. It works just as well, if not better than the other ones.
Absolutely.
So you guys, we use those antibacterial soaps too much.
Yeah, too much.